right, I think we will get started. There are other people that are joining us from the wait room. So welcome everybody to our next webinar for Team Primary Care, where we are talking about embedding psychological health and safety into training programs and into teams. If we can go to the next slide. We have here our Indigenous land acknowledgement that we have undertaken in partnership with our Indigenous Advisory Circle. I'm not going to read it, but I'd like to give just a moment for everybody a chance to read it, to reflect on it. And this is an especially difficult week as we go into remembrance for the residential school system on September 30th. Some are acknowledging that day with a day off work on Friday. Some are acknowledging it with a day off work on Monday. And so just take a moment to read this, and then we'll move to the next slide.
So welcome everyone. My name is Melissa Corrente. I'm a senior research associate at the University of Ottawa and a very proud member of the Canadian Health Workforce Network. I'm thrilled to be co-facilitating this webinar with my colleague, so I'll pass it over to her to introduce herself.
Thanks, Melissa. Good afternoon, everyone. My name is Kamlesh Tello, and I'm a program manager on the Access to Quality Mental Health Services team at the Mental Health Commission of Canada. And I'm happy to be co-hosting with Melissa, and I'm a member of the Team Primary Care Psychological Health and Safety team. I also want to mention at the MHCC, I work with our partners to promote the psychological health and safety of healthcare workers. And I'm working collaboratively with our Quality Mental Health Care Network. It's co-led by MHCC and Healthcare Can. And just to point out, one of our major initiatives is in this partnership is developing the development of the Quality Mental Health Care Framework. And it recognizes the importance of quality of mental health care for all, for including healthcare workers. Back to you, Melissa.
Thanks, Cam. So we want to recognize the subject matter being discussed throughout the webinar may deal with sensitive, uncomfortable, potentially triggering themes. So we want you to take care of your well-being. And if you find yourself in distress, please contact your local distress center. You can reach out to Wellness Canada, or you can text wellness to 741-741 at any time. And there's some additional information in the chat there as well. And then we'll go to the next slide. So our learning objectives for you today, we want you to leave the webinar having a better understanding of psychological health and safety in the workplace, but also your role in maintaining it. We want you to leave with psychological health and safety tools that you can use in a primary care team or a training program. And we want you to also have a link to evidence-informed and sector-specific resources. And finally, we want you to understand how these tools can be applied in practice. And next slide. So in order to set the stage for our webinar, I want you to start by reflecting if any of the following statements ring true for you. So have you ever felt less valued or less inclined to share in a team context? Have you ever received demeaning comments from coworkers, managers, or patients? Have you ever felt uncomfortable, marginalized, unheard, or insignificant? And finally, have you ever experienced role or knowledge questioning behavior? So psychological safety exists when you're not afraid to ask questions, take risks, speak your mind, admit mistakes, and share ideas and raise concerns. So we'll go to the next slide. So it's important to know what psychological health and safety is not. So it's not being nice or the freedom from conflict. It's not a guarantee that all your ideas will be applauded. It's not permission to slack off. Psychological safety is not a license to whine or to overshare with coworkers. So creating a culture of psychological safety does not compromise quality care or reduction in operational standards or expectations. So you'll notice in the comic on the right-hand side, someone has a great idea. Then they question if they should speak up. And then you notice the internal dialogue that's happening. And she ultimately decides it's not a safe space to share her ideas. So I think it's a really powerful representation of sometimes what you experience just in comic form. So we'll move to the next slide. So in the top left-hand corner, there's a really powerful tweet from a medical doctor. And she states, medicine has a major mental health and burnout crisis, yet psychological safety is still not measured or valued. So at annual reviews, you should really normalize asking, do you feel safe and supported to achieve your goals? The what have you done for us lately approach is toxic and potentially deadly. So research shows that measuring levels of psychological safety in teams offers a valuable way of identifying issues, and that creating a space for open discussion and reflection is critically important. And then there's a quote there from Wendy Jade, just an environment that's not safe to disagree in is not an environment focused on growth. It's an environment focused on control. So I'm going to pass it over to Cam, who's going to go over a few definitions with you.
Thanks, Melissa. So building on the ideas that Melissa was sharing, to clarify, what do we mean by psychological health and safety? So when we look at the definitions for psychological safety and psychological health, we see each has a different but important focus. So psychological health focuses on people experiencing a state of well-being, so that they can think and feel and behave in a way that helps them to effectively fulfill their roles, responsibilities at work, in their personal lives, and in society at large. With psychological safety, there's a focus on people being free from threats of harm to their psychological health. And when we look at more fully psychological health and safety, we're talking about the way that people interact with one another, the way that working conditions and management practices are structured in the workplace. Next slide, please. So psychological health and safety is an everyone issue. This includes service users and healthcare providers. Every year, approximately 20% of Canada's population experiences a mental illness that requires access to mental health services. Next slide, please. With most adults spending more of their waking hours at work than anywhere else, addressing issues of psychological health and safety at work is vitally important for all people in Canada. Unfortunately, as high as 70% of Canadian employers are concerned about employees are concerned about the psychological health and safety of their workplace. And even more concerning is that 14% don't think that their workplace is healthy or safe at all. And about 30% of short and long-term disability claims in Canada are attributed to mental health problems and illnesses. And this includes healthcare workers. So let's watch a short video before diving in. I'm not able to hear anything. I'm not sure if others can hear.
No, Karina, if you could share your audio. So if you could just pause for a moment. Under the three dots, if there should be something about sharing audio.
No other field makes
Perfect.
an impact quite like healthcare. Every day, healthcare workers dedicate themselves to providing quality care and making an impact in the lives of their patients, their families, and the communities they work in. But the things that make healthcare so rewarding can also be what make it a particularly challenging environment. Between the long hours and high pressure, healthcare workers experience higher rates of burnout, compassion fatigue, and sleep deprivation. Because of this, they are more likely to miss work due to illness or injury. When healthcare workers experience mental health issues, the consequences are felt on a broad scale. Their lives and the lives of their families are impacted. Other workers can feel more pressured, and the work environment can become less safe. This can impact quality of care and the patient experience. How can healthcare workers care for others when they themselves feel unwell? While individuals are responsible for their own health, organizations have a key responsibility in the promotion and protection of a psychologically safe workplace. No other field makes an impact.
Sorry, I didn't unmute myself. So thanks, Karina. Healthcare workers are dedicated to providing quality care. But when psychological health and safety in the work environment is compromised, it can negatively affect the quality of care and the patient experience. Even before COVID-19, healthcare workers were suffering from stress and depression, anxiety, burnout, and risk of suicide. They were already 1.5 times as likely to need time off due to illness or disability than workers in any other sector. Results from a national survey conducted during the pandemic by MHCC in partnership with Queen's University and HEC Montreal recognize that healthcare workers are highly resilient. They continue to work hard to care for others. That said, many are at their breaking point while trying to meet the challenges that have been amplified by the pandemic. 40% of healthcare workers reported feeling burnt out. 50% intend to leave their profession, and only 60% are satisfied with the quality of care that they're able to provide. Next slide, please. It's important to protect and promote the psychological health and safety of healthcare workers. Here in this slide, we see the many benefits of ensuring that healthcare work environments are psychologically healthy and safe. Benefits include decreased absenteeism and turnover, boost productivity, reduce errors, lower healthcare costs, increase the patient or service user satisfaction, enhance the organization's reputation, recruitment and retention, and improve morale, relationships, and sense of purpose. Every healthcare worker in Canada deserves to be employed in an organization that prioritizes psychological health and safety. The psychological health and safety of healthcare workers can make a tremendous difference in the quality of care they and their organizations can provide. Next slide, please. How can teams, training programs, and organizations improve the psychological health and safety in their environments? Well, Canada's national standard for psychological health and safety in the workplace, recognized as a leading practice by the Health Standards Organization, identifies 13 psychosocial factors that can promote or hinder psychological health and safety in the workplace. The standard offers a voluntary set of guidelines, tools, resources to guide organizations in promoting mental health and preventing psychological harm at work. Next slide, please. Sorry, I was muted again. Based on consultations with healthcare organizations, the MHCC and Healthcare Can developed 2 additional factors, especially relevant to healthcare: protection from moral distress and support for psychological self-care. Let's watch a short video about these 2 additional psychosocial factors.
Meet John. He's one of tens of thousands of healthcare professionals living in Canada who go to work every day. John loves his job, but every day is filled with highs and lows, from new births to emergencies and even end of life. Long hours and a hectic pace are John's reality, and that's on a good day. In times of crisis, when resources are strained, difficult decisions are made on the fly, and staff are forced to take on roles they've never done before. To put it bluntly, this line of work can be very stressful. Every worker deserves a workplace that supports and protects their psychological health and safety. And more organizations across Canada are taking action to put the right supports in place for their people. Not that long ago, John's workplace implemented the National Standard for Psychological Health and Safety in the Workplace. The standard is built around 13 key factors and designed to help employers of all types and sizes promote mental health and prevent psychological harm at work. But healthcare workers like John face 2 additional unique factors that do not happen in other types of workplaces. One is moral distress, and the other is psychological self-care. Moral distress happens when policies, procedures, or treatment orders prevent a healthcare professional from doing what they feel is right. Imagine that what John believes is the best way to treat a patient is different than what he's instructed to do. What if the situation is all new and there are no protocols to follow? Or in extreme situations where non-critical care has to be deferred. John knows his patient needs surgery, but now he's got to explain why they have to wait. What kind of weight does that put on John? Without supports in place, John feels conflicted and powerless, and that takes a toll. Add to that the second factor. John is used to putting his patients first. And when caring for others puts his own self-care in the back seat, things can fall even further out of balance. It's a spiral that can create all kinds of problems at work and at home. But John is a professional, right? He tells himself everyone has to deal with this here. I can't talk about it. I don't want to put more pressure on my coworkers. I'm on my own. The thing is, John isn't alone. Meet Mary. She's a healthcare administrator. She's also John's boss. But most of all, she's someone who understands that being a healthcare leader means caring for all people, including her own. Mary and her team have put in place wellness resources, including training and counseling that focus on psychological self-care and preventing moral distress. Some are structured like peer support programs, and others are less structured, but just as important, like making sure employees have some time to take a breather and recharge, no matter how busy things are. By taking action, Mary has created an environment that builds healthcare workers' mental resilience up instead of burning them out. And that's not only good for John, it's good for his patients, his coworkers like Sarah and Gabriel, and their families, and the hospital, and the community. Because making workplace mental health a priority helps employees be at their best. And that enables them to provide the best quality healthcare for all of us.
Thanks, Karina. So we've talked about the 15 different psychosocial factors, and our team took these 15 psychosocial factors and summarized them into 7 main themes. And there's a lot of intersection between the 15 psychosocial factors. So we were able to organize them in this way. The first is the organizational and team culture. This is about shared norms and values and beliefs, which are behavioral and problem-solving cues, and they must be based on respect. Workload management and work-life balance. This is where leaders are actively promoting work-life balance, such as ensuring that staff have enough time to complete assigned tasks. And then there's clear leadership and expectations. This is when effective leadership and support improve the understanding of expectations and roles, and it includes good communication. And psychological protection. So staff psychological safety is promoted, it's safeguarded, and stigma is effectively addressed. Protection from physical safety is where staff are protected against hazards and risks in their physical work environment. And the protection from moral distress is where staff can work with a sense of integrity while being supported by their profession and employer and peers. And finally, support for psychological self-care. This is where staff are encouraged to care for their own psychological health and safety. Next slide, please. The link between psychological health and safety and the quintuple aim has been made in literature that focuses on primary care, patient-centered care, and the health workforce. For example, in their 2014 paper published in Annals of Family Medicine, Bodemeyer and Sinsky advocated that in the American context, the triple aim of enhancing the patient experience, improving population health, and reducing costs should become the quadruple aim by adding improving the provider experience to this framework. The authors clearly state that care of the patient requires care of the provider. Next slide, please. So a psychologically healthy and safe environment leads to improved team learning and team performance and continuous quality improvement environments. When team psychological health and safety is prioritized, whether it's at work or in training programs, individuals feel safe to speak up, express concerns or new ideas without any fear of negative reactions from peers, leaders, or instructors and preceptors. Under these conditions, teams and trainees can feel more committed as a team member, be more engaged in improvements to healthcare quality and work processes, and even experience joy at work. When they do not, they shut off, they burn out, and disconnect from the team. And this reduces the communication that's so important to promote healthcare quality. Also, unreasonable workload expectations or expressions of microaggressions can also make team members and trainees feel overwhelmed and even silenced. Next slide, please. So the Canadian Health Workforce Network partnered with the Mental Health Commission of Canada and the University of Ottawa to develop a set of curated, evidence-informed resources to promote psychological health and safety for comprehensive primary care teams and training programs. And we're currently developing the Psychological Health and Safety Toolkit for primary care teams and training programs.
Pam, I'm going to have to interrupt you here. This isn't what we agreed upon for the webinar, and I think it's confusing for the audience. So Ivy, can you take over for Cam here and present the slides that we discussed?
Okay, so we're on slide 21, just in regards to the Psychological Health and Safety Toolkit. Okay, Sophie, I see your hand up.
Ivy, I'm sorry. I know I'm not part of the webinar presentation team, but as a member of our project team, I need to say something. I feel uncomfortable about what just happened. I've previously found myself in situations where I didn't know if it was my role or if I was in the position to say something. Cam, are you okay? I'm not sure if you're still at your computer, but if you are, would you be willing to return to the meeting so we can talk about this?
Thanks, Sophie. I want to reassure everyone that I am fine, and to let you know this was a mock scenario that our project team acted out. We wanted to give you a vicarious experience where there was a microaggression from one colleague to another. So in this example, it was from Melissa to myself. And then we also show how another colleague, Sophie in this case, chose to speak up because this interaction between Melissa and I didn't support a psychologically safe work environment. As mentioned, expressions of microaggression can make us feel overwhelmed and silenced even. And so we would like to take a moment, if we can go to the next slide, is just to have a debrief and conversation with everyone that, you know, in terms of what happened and how we can learn from this and how we can prevent and avoid this. So would like to open it up to all of you to please share with us when you saw this happening, how did it make you feel, you know, listening and watching to this situation unfold? I can say that from my view, my heart is still kind of racing, even though it's mock, because it doesn't feel right even when acting it out, and it didn't feel psychologically safe. And so it does make it difficult to feel like, for example, if this was real, that I could totally contribute and bring my full self to the work. And just wanted to hear from others too about how this made you feel watching and listening to this. Do you want to just raise your hand? I see some comments here. Oh my gosh, so glad it's mock skit. I was just about to check in on Cam. Oh, thank you, Danielle. I thought, what the heck? Exactly. Uncomfortable. I thought it was real and it was uncomfortable. Absolutely. Has something similar happened to you at work, or have you witnessed this at all? Happy to hear from your experiences.
And I think for Cam and I, it's really the debrief and the learning comes from reflection and talking about it. We wanted to create an uncomfortable situation, And it's important to recognize that microaggressions don't always occur from the top down. So sometimes microaggressions occur laterally, like in this case, or it could be from the bottom up. So they're often thought of as an interaction between the person that says the comment and the person who receives the comment, but it's also important to keep in mind the bystanders who are affected as well. So I'm going to go to Joanna. She's got her hand up.
Hi, yeah, I just thought it would be easier rather than put it in the chat. That was great. Thank you for including that in the skit, because that's like when I've experienced similar things in the past, it happens so quickly sometimes that I almost like I have to, like I'm suddenly kind of on that defensive hyper alert. Like, did I miss something? What's going on here? And my heart is racing. And often I feel silenced in that situation because it goes by so quickly that I'm not sure how to respond.
Yeah, thank you so much for sharing that, Joanna. And I think we want to empower bystanders to become active allies. Because like you mentioned, sometimes it happens so quickly, and we realize everyone's probably eating lunch during the webinar. So we were hoping that someone wasn't going to the fridge for, some lunch and they missed out on the skit. But yeah, I appreciate your comment. Any other thoughts from anyone who's watching or listening?
I see a comment that this has happened to me numerous times, usually from the same individuals. So thanks for sharing that. And we will also go to the third question in a moment, so we can also think about how this can be prevented, especially in a work environment where we are meeting and dealing with the same people, and we want to see the culture change to become more psychologically healthy and safe for all of us. So I don't see any other hands up. Melissa, should we go to the third question?
Sure.
So what do folks think about what could be done to prevent or avoid this from happening in the future? I mean, okay, Donna, yes, please, we'll go to you.
Yeah, it was difficult throughout my career. I've been around a long time. And it usually would be around topics where people didn't like what the answers were, like privacy, implementing privacy or things like that. And it would happen, at national meetings, and it usually would be one individual. And I thought I was imagining it, because everyone would be quiet. And I thought maybe I presented it wrong. And if I push back, sometimes it seems that, I was in the wrong or whatever. So, I often, became a bit more silent. But what I found very helpful were individuals would approach me after. And then I realized, no, it was, it was the approach. And there was one meeting where somebody did actually address it. And that was really helpful, because what they said is, I don't appreciate, the manner in which you're saying this, and it really did help. Not entirely got rid of the situation, but, I don't know. And I've been at meetings where I've seen things happen and you're hesitant to say anything, because again, if you've experienced it, you're nervous that it's going to happen, to you as well. So difficult.
Yeah, thanks so much for sharing your experiences, Donna. We really appreciate that. But yeah, just hearing someone validate the feelings and experiences can be extremely helpful. Because I know there is a lot of hierarchy within healthcare. So oftentimes people are fearful to speak up just based on direct hierarchy, for sure. Any other thoughts you want to add, Cam?
Yeah, I was thinking as well, this is happening in a team environment, and perhaps having, and I like that someone directly addressed the individual, and it can be difficult to do that, and that is one approach as well. A really good one is also just also having a team dialogue on, and having people share what makes one feel safe and supported on the team. And giving examples of what does that look like and feel like for yourself, and everybody can kind of go around and share that, and then just recognizing and speaking about how we're in a constantly environment to improve, to learn, to grow. Things are always changing. They don't stay the same. So, allowing people to, if mistakes happen as we're learning, which is a natural process of learning, that it's okay, that we can learn from them, and talking about that, being compassionate and supporting each other. I think to start to have conversations about that and how they help and how they're almost, expected as well. Wonder could help. Christine?
My thought is just around, like, I think in healthcare, we have this historical culture of just being, of just taking it, right? Like whether it's from patients in our day-to-day interactions or our colleagues. And so I think one of the things that we could do to prevent and avoid things from happening like this in the future is just being able to have discussion and share information like this with our teams, being able to have that open communication so that our staff feel comfortable sharing when situations happen so that it can get addressed quickly and effectively. And exactly what you said, Cam, having discussions within our teams to understand what that looks like and how to respond to it, I think is important. And this is a great start.
Thanks so much for sharing that, Christine. And it kind of reminds me of a simple activity that a team or an organization could do. And it's a nice visual. If you have a big whiteboard or some kind of a large area on the wall, you can draw a big circle. And inside the circle are all the things that the team members in the organization can do to make you feel safe. And on the outside of the circle are things that are that you would not expect to see in the workplace, like harassment, bullying, that type of thing, or specific incidents on the outside of the circle. So just having a team create, those inside circle things that are safe, that make you feel psychologically safe at work. And then on the outside, including examples of things that you don't want to see and that make you feel unsafe. And just having that visual can be really powerful too. Yes, Ivy.
Hi, I think Karina is not able to put up her hand and would like to ask a question. Karina?
Thank you. Yeah, I don't know if maybe it's because I'm the one sharing a screen. I don't find the reactions button. But yeah, I just wanted to mention that this has happened to me as well. Maybe in other context, not in a professional context. But something that has worked for me is to practice what I would say, because it's so shocking and we get so nervous and we froze that sometimes we need to practice. So think like what I would like to say and be able to speak up. It's awesome when our colleagues can speak up, but also being able to speak up for ourselves. I think it's great. And also as we have been learning, it's not ensuring the psychological health and safety of a team or training program is not only about, the responsibility is not only on the individuals, but also on the leaders, the organizations. So having policies in place also can help ensure the psychological health and safety of the teams and training programs. Thank you.
Thanks for sharing, Karina. Any other final thoughts from the group before we move on to some resources that you can use? Yes, sorry.
Sorry, I just wanted to say that Karina had an excellent segue to our next conversation, that notion of practicing, and that I think it's really important because I think we all feel our feels, the discomfort, and our apology. We did put a disclaimer at the front, but we wanted to have this really fruitful conversation. But we have to get from the feels to action. So how do we move from action? And Karina really hit the nail on the head. It's practice. And so this needs to get embedded into training programs, practicing when these types of things happen. Because the more that we practice, the more that we have pathways to go to, because the feels often include shock. And so that makes you less able to act. And so the more that you practice these and have different scenarios that you've worked through, like a simulation, the better. So that was a great segue, Karina. Thank you.
Thanks, Ivy. Donna, we'll go to you.
Sort of earlier life experience. I was in medicine when women weren't liked here. And I do think a lot of this is gendered. You know, I worked at many settings where as a female, I felt I could not voice that I was uncomfortable because then I was being emotional, you know. And the men that I worked with at the time, you know, when they were angry, I mean, for me, what anger would come out in tears, and then I'd be seen as, you know, oh, she completely lost it, you know, from the men in the group. I mean, I think it has improved, but I still think there is, you know, a lot of gender variation. The other thing I found is that a lot of times, you know, the individual imparting microaggression was not necessarily aware that they were. And, you know, when I approached a number later on, this is all through my life, and I realized that they themselves felt bullied. And, you know, and that what I was seeing was a response to that sensation, you know, and that really helped improve things. So it's quite complex.
Mm-hmm. Yeah, thanks for adding the gendered perspective, Donna. I appreciate that. Hussam, we'll go to you next.
Yeah, just like I have one thought about, especially the third question, like what could be done to prevent or avoid this from happening in the future. I think in an organization, like the leaders who are, or the employers who are responsible for this, they need to be like embracing a culture of civility to move forward. Otherwise, the workers, they won't, even they're using, you know, some strategies, they won't like feel safe if the leader is not embracing that culture. So I think that it's like leaders need to learn how to be caring with themselves, and then how to care about the employers. This is very, very important, I think.
Yeah, thanks for sharing that, Hussam. It reminds me of Ivy's quote of leadership matters.
Yeah.
So yeah, thank you for sharing that. We'll go to the next slide, and I'm going to share a resource to support each of the 7 themes. So to address organizational and team culture, I highly recommend the Vitals Tool Workshop. So this can be introduced as a tool for processing and addressing microaggressions, similar to what our skit was. It's a way to address it in a very practical way. So the acronym stands for validate feelings and experiences, inquire to obtain more information or clarification, take time to mirror or reflect what the person says, assume the best of each other and need for clarity, leave opportunities for follow-up conversations, and speak up for others affected by negative biases or microaggressions. So that's just one tool that we found that we thought was very helpful for dealing with team culture and microaggressions specifically. And then we'll go to the next resource. This has been a favorite of ours for a while. It's called Getting Rid of Stupid Stuff, and the acronym spells out the word GROWTH. And this is really a great one for addressing workload management and work-life balance. So it was developed by the Hawaii Pacific Health, and it's invites clinical staff who use the electronic health record to just kind of identify documentation and other practice requirements that need to be eliminated or changed or modified. And there's been very positive response to this program across different clinical staff members. The next tool in our toolkit is called On the Agenda, and it falls under the theme of clear leadership and expectations. It's a series of free workshop materials and facilitator tools to address the different psychosocial factors. You can create an action plan with your team to improve psychological health and safety, and they break each workshop into 2 parts. So there's creating awareness and creating change. And then the next tool, some of you may have already used this tool. It's a fairly well-known one. It's the Physician Wellness Hub, and it addresses almost all of the themes, but we chose psychological protection because it offers a variety of different wellness tools and resources. And the integrated approach that the American or the Canadian Medical Association takes, it really meets the needs of physicians, medical learners, medical educators, and then leaders, like Hussam mentioned. So really targeting the leadership within an organization. And you can refine your search by resource type, audience, or topic. So very user-friendly. The next tool we wanted to highlight for you addresses protection of physical safety. And we recommend the Rewind communication tool. So this is a 60-minute workshop for residents to provide an overview of mistreatment in residency and to teach them Rewind, which stands for relax, express, why, inquire, negotiate, and determine. And it's really just a communication tool to address mistreatment directly. And that's from the American medical colleges. And then the last tool I'm going to highlight for you before I pass it over to Cam is well-being debriefing. So this is a really important resource that covers protection from moral distress. And a well-being debrief for healthcare workers, it offers a really powerful remedy, and it should be a standard practice in healthcare institutions. So debriefings address core issues that contribute to an emotionally depleted workforce. They foster a supportive culture among colleagues, and they have a variety of different goals like lowering levels of stress, increasing social support, and sharing coping strategies and resilience tools with peers. So I'm going to pass it over to Cam to share the final resource, but these are just a few tools we wanted to highlight for you.
Thanks, Melissa. So this last tool is to support the psychological support for psychological self-care, and the Caring for Healthcare Workers offers assessment tools that are available to evaluate the 13 psychosocial factors and the 2 additional factors that relate to healthcare. So the first tool is a psychosocial survey for healthcare, which is a confidential online survey that staff complete in a health organization or in a work area. And secondly, the second tool is the organizational review for healthcare, and it's downloadable audit tool, and helps to identify the psychosocial factors, the key indicators, and the actions for the organization or work area. So once the survey or review questions are completed, then the tool will also put together and provide a report of the results. So we encourage you, these are just a sample of the resources. There will be more resources as well in the Psychological Health and Safety Toolkit for training and teams. And next slide. So to leave you with a couple of quotes and food for thought, psychological safety is present when colleagues trust and respect each other, and they feel able, even obligated, to be candid. And also, the golden rule states that we treat others as you would want to be treated. When it comes to psychological health and safety, however, the platinum rule prevails. Treat others as they would want to be treated. So we leave you with that. And then in the next slide, we'd like to acknowledge our whole psychological health and safety team for everyone's help in preparation for today's webinar. And so I'd like to thank Yelena, Magdalena, Hussein, Ivy, Samuel, Melissa, of course, Sophie, and Karina. Thank you. And then we'll go to the question and answer period. We're looking forward to hearing all of your questions, and please join us, and I'll transfer to Ivy now.
Great, thank you, Kamlesh. And Karina, I think we can pull the slides off just so that we can see each other. So if there are other comments or questions, if you want to direct that to one of the members of the team who has presented, be really pleased to respond to that. So please just opening it up to folks, and I will keep my eye on the chat just to see if there's anything there. And we're seeing some expression of thanks. Yes, and I wanted to give a big hand to Melissa and Cam and Sophie for their incredible acting abilities. Trisha, please go ahead.
Good morning, everyone. Well, at least it's still morning for me. I know it's not for everybody else, but thank you for the webinar. Some really helpful information. It's certainly a plethora of tools and information to go through. I really appreciate that. I am executive director for a community health center, a nonprofit community health center in Edmonton that serves vulnerable population in Edmonton. So some really challenging situations and things that people have to experience and or witness. And so this is psychological well-being has been top of mind for me, for my staff, since I started with this organization almost 3 years ago. But as a small nonprofit, our administrative team is quite small. And so trying to put together a robust program, whether that's training upon, onboarding or that kind of thing, however we want to approach this, is something that often gets done off the side of our desks, unfortunately. And so what my question is really, the time that it will take to go through all of these resources, although very valuable, and I do intend to, is going to take some time. And I'm wondering if anybody has any insights, and this is kind of separate to the content, but has any insights or information or recommendations of either or an organization or someone we could contract that could help us maybe and design a bit of a program that's specific to our organization and its needs and the mix of staffing that we have. Does that exist anywhere? And does anyone have any ideas that they could share?
Thank you, Tricia. So I'm going to pass that to Melissa and Kamlesh.
Yeah, certainly, Tricia, we could send you information about folks if you're looking for support, whether it's through consultants that work in the area and specialize and work specifically with an organization to see what are the challenges and how they can support you in meeting your needs and your goals. We could share that information for sure.
Thank you.
Melissa?
I would say that the toolkit that we've developed, although there are some amazing resources in there, it can be very overwhelming. And we realize that. So we are happy as the psychological health and safety team. We've kind of been doing some personal shopping for different teams and organizations to help them. So you can definitely reach out to us and we could take a look and try and help you out. And just take a look at what are your top 2 needs and kind of direct you into some resources that we think would be the most helpful. So you don't have to sort through. We can create like a little short list for you for sure.
That would be amazing. Thank you. I just put in the chat too to say, how would we contact you directly?
And Karina, our amazing person who's putting contact information and all of the links, will probably put that into the chat. So thank you so much, Karina and Tricia. Shelley, please go ahead.
Hi there. I, in my day-to-day work with a bunch of project leads that support healthcare initiatives, so different projects for specific areas of care. I was wondering if you have any tips on helping somebody identify that they are one of those people on a regular basis. I'm thinking there was a meeting that I've been in, and it's a recurring meeting. It doesn't happen that often, but there's always one person. It's always that one person that has something to say, and it shuts the other person down and shuts them up like right away. So without antagonizing or like how do you get them to acknowledge that in a nice way?
That's a really important question, Shelley. And I'm reflecting on a completely different team and activity, where we were looking at women's leadership. And there was a microaggression expressed by someone who would identify as white to someone who identifies as Black. And we were all shocked in those circumstances. And I later had a conversation with a colleague of mine who identifies as Black. And I said, so what do we do in those circumstances? Again, didn't act in the moment, what to do what would one do in the moment in that regard? So first of all, I want to acknowledge it's really important for us to gather some resources and to practice it. And what she had suggested, and I want to recognize that this takes a lot of emotional energy. What she suggested is to kind of give people a bit of an out and to say, for example, I know it wasn't your intention to do X, but someone could have interpreted what you said or what you did in this way, so that you give them a way to save face because it's not intentional, but that the actions had an impact. And that's really hard to do, but that's what was suggested to me in that particular context. Melissa or Cam, is there anything in our toolkit that would help?
I'm not sure if there's anything in the toolkit. I'll have to take another look, but one thing, my trade is teaching. And as a teacher, one thing I've found with eliciting feedback is I don't do it all the time, but sometimes instead of eliciting verbal feedback, I will pass out sticky notes and get everyone down to write down their ideas, because I do find if there's one or two people in the classroom who are dominating the conversation, it just shuts everyone else down. Whereas if you give everyone a sticky note, even if they don't write anything on it, everyone has one in front of them. Everyone has an opportunity to write something down, and then I just collect them all at the end. And it can be anonymous or they can put their name on it, but just giving people different avenues to communicate. But I will definitely take a look, Shelley. And if there's something in the toolkit that I see that would address that, I'll definitely connect with you.
Fantastic. Thank you.
Thanks, Shelley. Kamlesh?
Yeah, I think having that dialogue, I think that I would suggest that, and it's a great way to communicate. Perhaps they don't have the same perspective or understanding. And you know, the last quote we had, food for thought, is not how treat others how you want to be treated, treat others how they want to be treated. So I think it's an opportunity to understand like our differences in personalities and how we interpret certain comments and whatnot. Some things can be off-putting for some, while not others. And so I think it's helpful to have a conversation about how it's affecting one person, affecting you, and then you know, reaching out to them for help. Like how can we make this better for both, for everyone, right? And having them kind of a role in how they could support, you know, like giving them the benefit of the doubt and saying how they could maybe, you know, the person could give suggestions as well of what would be helpful to them, and then trying to loop back with them in you know, having like a follow-up with them too, to kind of see, you know, how the person is feeling and if there's any more things to clarify.
Awesome. Thanks.
Thank you so much. So Karina, if you could post the last slide just to kind of, again, thank you everybody for your engagement. That's been great. Thank you to the presenters. It has been wonderful working with the team in that regard. And just to let you know that there are some other webinars that are going to be coming up. And we'll just go to the next, click on the next couple of slides. Yeah. Super, thank you. So October 11th, we will have the Equity, Diversity, Inclusion, and Accessibility in Collaborative Team Practice on October 11th at 12. October 23rd, we will have a guest who will be addressing From Hurting to Healing, Restorative Approaches to Advancing Equity and Justice. So you see that there's a theme building here. November 15th, considerations for planning the composition of primary care teams based on community need. And this is one of our teams that will be doing a presentation. And then December 8th, supporting change using generative approaches. And so please follow us at Team Primary Care for registration and for those webinars. The link is there. If you liked this presentation and webinar and want to recommend it to others, but please don't tell them about the skit so that they can experience that vicarious discomfort that you all experienced, including us. And so do pass along the webinar. It will be, as you know, it's being recorded. It will be posted and on the CHWN YouTube and the Team Primary Care website. So with that, thank you, everybody. Have a great rest of your morning, afternoon, and week. Cheers.